Post-traumatic stress disorder, or PTSD, is a mental health condition. It can happen after a terrifying event. This event can be something you experienced or witnessed. PTSD is a normal reaction to an abnormal situation. People with PTSD may feel stressed or scared. This happens even when they are safe. They may relive the trauma in their minds. This can cause distress and anxiety. PTSD can affect anyone. It is not a sign of weakness. There is hope for healing and recovery. With the right support, individuals can manage their symptoms and live fulfilling lives. Intrusive symptoms are a hallmark of PTSD. They are often the most distressing and disruptive aspects of the disorder. They involve unwanted and distressing thoughts and memories of the traumatic event. These thoughts can come out of nowhere, catching the person off guard and making it difficult to focus on the present. Imagine having vivid nightmares that transport you back to the trauma, as if it were happening all over again. These nightmares can be so realistic that they cause the person to wake up in a state of panic, drenched in sweat, and feeling as though they are in immediate danger. These intrusive memories can be triggered by seemingly harmless things, a certain smell, a sound, or even a passing thought. For example, the smell of smoke might remind someone of a fire they experienced, or a loud noise might bring back memories of an explosion. Flashbacks are another form of intrusive symptom, where individuals feel like they are reliving the trauma in real time. During a flashback, the person may lose touch with the present moment and feel as though they are back in the traumatic situation, experiencing the same fear and helplessness all over again. These experiences can be incredibly vivid and distressing, leaving individuals feeling overwhelmed and frightened. The intensity of these symptoms can vary, but they often leave the person feeling emotionally drained and physically exhausted. The unpredictable nature of intrusive symptoms can make individuals feel like they have no control over their thoughts and emotions. This lack of control can lead to feelings of frustration, hopelessness, and isolation as they struggle to manage their symptoms and maintain a sense of normalcy in their daily lives. Avoidance symptoms involve steering clear of anything that might trigger memories of the trauma. This can be a natural response to protect oneself from the emotional pain associated with those memories. This avoidance can manifest in various ways, such as avoiding people, places, or activities that remind them of the traumatic event. It might also include avoiding conversations or thoughts about the trauma, as even thinking about it can be distressing. For instance, someone who witnessed a car accident might avoid driving or even being a passenger in a car. They might take longer routes to avoid the site of the accident or refuse to travel by car altogether. While avoidance might provide temporary relief, it can make it difficult to engage in everyday life and maintain relationships. This isolation can lead to feelings of loneliness and exacerbate the emotional distress. Avoiding reminders also prevents individuals from processing the trauma and beginning their journey towards healing. Without facing these triggers, the trauma remains unaddressed, hindering recovery. By confronting their fears and gradually re-engaging with the world, individuals can start to regain a sense of normalcy and control. This process often requires support from friends, family, or mental health professionals who can provide encouragement and guidance. Therapeutic approaches such as cognitive behavioral therapy can be particularly effective in helping individuals confront and process their trauma. Mindfulness and relaxation techniques can also aid in managing anxiety and reducing avoidance behaviors. Over time, with consistent effort and support, individuals can overcome avoidance symptoms and lead fulfilling lives. Reclaiming their sense of safety and connection with others is a crucial step in the healing journey. PTSD can significantly impact an individual's thoughts and feelings. They might experience persistent negative thoughts about themselves, the world, or others. These negative thoughts can be pervasive and difficult to shake off. Individuals with PTSD might also struggle with feelings of guilt, shame, or self-blame, even if they were not at fault for the traumatic event. Emotional numbness is another common symptom, where individuals feel detached from their emotions or have difficulty experiencing positive feelings. This emotional detachment can make it challenging to connect with loved ones or find enjoyment in activities they once found pleasurable. Section 5. Changes in reactions and responses. Hyperarousal symptoms. Hyperarousal symptoms involve being in a constant state of heightened alertness and reactivity. This means that the body and mind are always on high alert, ready to respond to any perceived threat, even if there is no real danger present. Imagine feeling like you're always on edge, as if danger is lurking around every corner. This constant vigilance can be exhausting and can take a significant toll on one's mental and physical health. Individuals with PTSD might experience difficulty sleeping, startling easily, and having trouble staying asleep due to nightmares or intrusive thoughts. This lack of restful sleep can exacerbate other symptoms and make daily functioning even more challenging. They may also feel irritable and prone to anger outbursts, often over seemingly minor issues. This irritability can strain relationships with family, friends, and colleagues, leading to feelings of isolation and loneliness. In an attempt to manage these overwhelming emotions, individuals might engage in self-destructive behaviors, such as substance abuse. This can create a dangerous cycle, as these behaviors often lead to further emotional and physical health problems. Reckless driving is another way some people cope with their hyperarousal symptoms. The adrenaline rush from dangerous activities can temporarily distract from their inner turmoil, but it also puts them and others at risk. These hyperarousal symptoms can be incredibly draining and make it challenging to relax and feel safe, even in familiar environments. The constant state of alertness can prevent individuals from enjoying activities they once found pleasurable and can make everyday tasks feel insurmountable. Section 6 causes when trauma leaves its mark. PTSD develops after a traumatic event. Trauma is deeply distressing or disturbing. It overwhelms our ability to cope. Experiences like war, assault, or natural disasters are common causes. However, trauma is subjective. What one person finds traumatic, another may not. Witnessing violence or experiencing abuse can also lead to PTSD. It's important to remember, PTSD is not a sign of weakness. It's a natural response to an unnatural event. Section 7. The impact of PTSD, life in the shadow of trauma. PTSD can cast a long shadow over various aspects of an individual's life. It can affect their work, relationships, and overall well-being. Individuals with PTSD may struggle to maintain employment due to difficulties concentrating, managing their emotions, or interacting with colleagues. The constant state of hypervigilance and fear can put a strain on relationships, making it challenging to connect with loved ones and maintain intimacy. Furthermore, PTSD can contribute to physical health problems, such as heart disease, chronic pain, and gastrointestinal issues. Section 8. Seeking help. The first step to healing. Seeking help is crucial for overcoming PTSD. Acknowledging the need for support is a sign of strength, not weakness. Reaching out to a mental health professional, such as a therapist or psychiatrist, is often the first step. These professionals are trained to diagnose and treat PTSD. They provide a safe and confidential space for individuals to share their experiences and work through their trauma. Remember, seeking help is a sign of courage and a commitment to healing. Section 9. Therapy, talking, and processing trauma. Therapy plays a vital role in PTSD recovery. It provides a safe and supportive environment for individuals to process their trauma and develop coping mechanisms. Several types of therapy have proven effective for PTSD, including trauma-focused cognitive behavioral therapy, or CBT, and eye movement desensitization and reprocessing, known as EMDR. Trauma-focused CBT helps individuals identify and challenge negative thoughts and beliefs that contribute to their PTSD symptoms. EMDR, on the other hand, uses bilateral stimulation, such as eye movements, to help individuals process traumatic memories and reduce their emotional intensity. Section 10. Medication finding relief from symptoms. In some cases, medication may be recommended alongside therapy to manage PTSD symptoms. Antidepressants, particularly selective serotonin reuptake inhibitors or SSRIs, are commonly prescribed to alleviate symptoms of depression, anxiety, and intrusive thoughts. Other medications, such as prazosin, can help reduce nightmares and improve sleep quality. It's important to note that medication alone does not cure PTSD. It primarily helps manage symptoms and improve an individual's ability to engage in therapy. Section 11. Hope for healing. You are not alone. Recovering from PTSD is possible. It takes time, support, and self-compassion. Remember, you are not alone in this journey. Millions of people worldwide have experienced PTSD and gone on to lead fulfilling lives. By seeking professional help, engaging in therapy, and surrounding yourself with a strong support system, you can heal from the trauma and reclaim your life. There is hope for a brighter future, filled with peace, resilience, and well-being.